Hello, hello. Welcome back. How are we doing tonight? Starts a little late. I'm working on some of the nervous system and cardiovascular physiology today. So I'll plus cardiovascular later. Get onto that. How you guys all doing tonight? But welcome. It's good to be back here again with everybody. Would I be able to do another live about the integumentary system and the tissues? Yeah, when would you like to see that by? Thanks for joining and thanks for liking and everything. I am going to upload the integumentary system and tissue live that I did the other day onto YouTube. I actually just uploaded the digestive system one. I'm working on getting those up. It takes a while from the process because they're so long. If I could do tomorrow morning? Yeah, I can do tomorrow morning. I can probably do like 10 a.m. tomorrow morning. Is there anything specific you'd like to see from there? I can't do pictures, apparently. It's not. It's my name. If you just go to my profile, it's linked in my profile. If you go to the links. Or if you send me an email, I can just send you the link, but it should be there. But the digestive system one's up, but I will put the other one up. Hopefully I'm gonna have all of these up. Wait, have I been through these questions? Not yet. No, I just grabbed these questions today, so we haven't done these yet. We just came live, so. But there are any types of questions from the integumentary system or? I see each layer. Okay, yeah, we can do that. All right, we'll get started here. All right, we'll start with number 1 here. Which of the following is the basic unit of the nervous system? I'll give you guys a couple seconds to answer that. If you're just joining us, thanks for joining. Ready for the cardiovascular system? Yeah, we're going to do some cardiovascular system. I got some questions on there. Really pretty good. But like I mentioned, all of these the pictures of the questions and everything will be on my Instagram, and then I will be uploading the live to YouTube afterwards. But number 1. The answer is B, neuron. Neuron is the basic unit of the nervous system. Number 2, which part of the neuron receives signals from other neurons? Which part of the neuron receives signals from other neurons? Did you go over the neuromuscular junction for muscles already? No, I have not. I'll be doing that later in live. I'll be doing that later in the live. I'm going to have a portion at the end of the questions where you guys can ask me to explain some topics, and I'll go through them. Just stick around for there, and we'll go through those. All right, but number 2 is also B, and then is the dendrite. 3, which division of the nervous system controls involuntary actions like heart rate and digestion? Give you guys a couple seconds to answer. Thanks for joining. Thanks for following. I really appreciate you guys. Where do I get these worksheets? I make them myself. They come from I pretty much just come from my notes and some of my old materials from whenever I was a TA and tutor. Awesome. Today we're going over neurons in the muscle system. Gotcha. But number 3 is B, the autonomic nervous system. And then number 4, which part of the brain is responsible for balance and coordination? Give you guys a couple seconds to answer that. We have been going over some of these already. Or at least we've talked about this in previous lives. They're all B, yes. You can't get tricked up about which answer choice. I once had a teacher in high school. He would always do, like, there was one test where he had, like, B, B, B. For 30 answers, there was B, and the last one was C, and everyone, like, lost their mind about it. It was, don't ever get tripped up by that. It does not matter. Which part of the nervous system includes the brain and spinal cord? Number 5. We'll start off with some easier questions, and then move on to some more difficult ones. Then I do have some application-based ones here at the end. The last 10 there's 30 questions for the nervous system, and there's 30 questions for the cardiovascular system, and then the last 10 questions of each are all application-based. So we'll go over some clinical problems. Number 5, you guys are getting it right. It is D, the central nervous system, and the CNS and the PNS. All right, number 6, what is the function of the myelin sheath? What is the function of the myelin sheath? Around what time? What time we're going to go over the cardiovascular system? I'm not sure how long this will take. There's 30 questions, though, so we're on 6, so we kind of just started. So probably, like, I don't know, maybe like another probably like a half hour, I'd say. Half hour, 45 minutes. Do I ever go over heavy questions? Not today, but I can. If you send me an email on what you'd like to see for some heavy stuff, I'll make it. Number 6 is A. You guys got it. It's transmit electrical signals faster. Number 7 asks, the gap between two neurons where neurotransmitters are released is called what? Ooh, this chapter was my jam. Yeah, I like the nervous system. The nervous system is very fun to learn about. So number 7 is B, synapse. I did see a couple people putting another answer. Do we need to go through this one? Do we need to go through this one? Alrighty. Yes, because they're on it, right? Alright, so a synapse is like kind of like a small gap in between two neurons where communication occurs. So an axon hillock here, I'll go over this one first. Why is A wrong? This is part of neuron where action potentials, some put APs, are initiated. But not where they're released. So, not released. This is kind of in the way. The node of Ranvier. These are gaps between the myelin and axons. And these like help increase speed. But not involved in neurotransmitter release. And the dendritic spine, these are like small protrusions. And they function to increase surface area. I'm going to put SA for surface area. Does that help answer the question? Hi, Pamela, how are you doing? Let me check the comments real quick. Love how EVB locked in for you. No kidding. Yes, yes, calcium. Halate. Are we all good on that one, guys? Did that help? Yes, thank you very much. Alrighty. We'll move on here. Number 8, which ion is primarily responsible for the depolarization phase of an action potential? Give you guys a couple seconds to answer that one. I'm seeing a couple different ones here. I'll give you guys a couple more seconds and then I'll probably explain this one because this is kind of important though. You guys can get this one. So. But the answer is B, sodium. So during the depolarization phase, this is where Na channels are open. So this is where a rapid influx of sodium ions enter the neuron, which essentially causes more positive, which is about 30 to 40 MV. The reason calcium is wrong, well, calcium is very important in neurotransmitter release at synapses, but it does not influence the depolarization. Put an X, no depolarization. Potassium is responsible for repolarization. And this is when K channels are open, which create a more negative resting, more negative potential, not resting. And then chloride, obviously, this one is going to be hyperpolarization. Which, again, makes the cell I guess we'll do more negative. That's probably a better way to put it. This also makes it more negative. So increase the negativity. Which inhibits action potential, AP. Alright, does that help, guys? If you want a PDF of it, it's going to be on my Instagram afterwards. Same as my TikTok. Yes, thank you. Are we all good on this one? I was thinking about cardiovascular system. Yes, cardiovascular system, yeah. Thanks for following and thanks for joining, guys. I really appreciate it. Thank you for spending your Thursday night with me. Cell biotest, it's correct. Alright, I'm going to move on. Number 9, which neurotransmitter is most associated with muscle contraction at the neuromuscular junction? You guys a couple seconds to answer that one. You guys should get this one, yeah. B, acetylcholine. Oop. Do you ever just Do you ever do just physiology study? I'm having a really hard time with it. Yeah, so physiology, I'll write this in here real quick and then I'm going to read number 10 here and then I'll answer your question, beating. The fight or flight response is controlled by which subdivision of the autonomic nervous system? So physiology is a lot of how. So I always practice explaining things out loud. So for this, explain out loud. Any sort of process. Every time you're learning how something works, explain out loud. Alright, looks like you guys are all getting this one right. 10 is C, sympathetic. Let's get green in here again. Moving on to I'll leave this up here for just a second. But moving on, I forgot to put a space there. Bear with me there. Sorry about that. Anyway, which of the following is not a function of the hypothalamus? I'll leave the last one up there. I think I'm a genius for sure. You definitely are a genius. I am using GoodNotes. Whoever asked what app I'm using. Thanks for following and thanks for joining, guys. A new follower is here. Awesome. Welcome. AZ, thank you. Number 11 is B. Controlling voluntary muscle movements. Get that one right. Where do these questions come from? I made them myself from my class material. Which glial cell type is responsible for forming the blood-brain barrier? They're great. Thank you. This is for anatomy and physiology. I have the title up here. What class? Give you guys a couple seconds. Seen a couple different ones. I'll probably do we want an explanation on this one? This is definitely going to probably be one that shows up on an exam. All right, so the answer, which glial cell type is responsible for forming the blood-brain barrier? Let's see, it's astrocytes. So oligodendrocytes are what are responsible for producing the myelin sheath, the microglia. These are immune cells of the CNS, so immunity in CNS. It's kind of like your, they do phagocytosis, so they're kind of like your macrophages in a way. I always remember that just because, like, M for, macrophage also has an M in that, and Schwann cells. They have the same function as oligodendrocytes, but in the PNS, so I would just put CNS, and then same as, but PNS. Alrighty. Let's see here. Where can I get these practice questions? They're going to be on my Instagram after the live. It's the same as my TikTok username. Alright, I actually am about to upload hormones. We did hormones the other day, and I'm about to upload them to my YouTube. The link to that's in my bio afterwards. Just want to support those, yep. I love anatomy and physiology. Got an A in both. Congratulations. My For You page is getting scary when it comes to knowing what I'm learning. Yeah, a lot of people have been requesting some of this stuff, so I figured. Did you take your own notes in both classes? I took all my own notes in classes. This is a good MCAT review. Yes, it can be definitely a good MCAT review. 13. In a reflex arc, what is the correct order of signal transmission? Give you guys a couple seconds to answer that. Have I done skeletal system? Oh, I'm so sorry, guys. Whoops. I was kicking my monitor. I did it the other day. Ariello. I have started uploading them to YouTube. So that skeletal system one should be up today or tomorrow. Everything's just processing on YouTube now, so I'm just waiting for it to process and then it'll get uploaded. I have everything else ready for it though. This is semi-good religion for biology. Yeah, that's not specifically biology. Do I ever do psychology? I can do psychology. Alright, but the answer here is B. Number 13. It goes sensory neuron to the CNS, motor neuron, and effector. I could possibly. Do I do a pharmacology? I can do a pharmacology one if I have enough requests for it. Normally I kind of do my labs based on like what's kind of whatever's popular in terms of the request. Yes, my midterm is coming up in 3 weeks. You said psychology midterm. Yeah, let me Kels, if you want to send me an email about what's on your midterm, I can go over a live for it. I can prepare some questions. Please do pharmacology. Yeah, send me here, I'll put it here for now. That's my email. Send me an email what you want to see, topic wise, for lives, and I'll do them. I have questions for all of them. Yeah, send objectives for yeah. This is anatomy and physiology. This is normally like a prereq for nursing. This is for pre-meds and exercise science students normally. And then some like medical student type questions near the end. I'm trying to hit all the bases. We'll move on to number 14 here real quick. Damage to the Broca's area of the brain would primarily affect definitely lymphatic and respiratory soon. I actually did the respiratory system earlier today. Where was you 8 hours ago? I actually was live almost 8 hours ago. I was live at like 9:30 a.m. this morning. Eastern Standard Time. But I am going to be posting. Can you? But I am going to start posting all of the lives to YouTube afterwards, so you guys can rewatch them. And if you missed any other lives, like this morning, we did the respiratory system for some people who had been asking about it. Before their exam. So I will have that uploaded hopefully either tonight or tomorrow, depending on the YouTube processing time. But number 14, damage to the Broca's area of the brain would primarily affect speech production. But like I said, I have my email up here. Send me an email on some topics that you want to see. I definitely put a priority towards my email when it comes to that stuff. So, oh, you didn't get a notification? I'm sorry about that. Moving on to number 15. Thanks for joining and thanks for liking the live, guys. I just want to, before I continue on, I appreciate you guys. If you're just joining, we're going over some nervous system questions. But number 15 is which ion is most responsible for repolarization during an action potential? And also, thanks for following here. I'm happy to see some new faces. All right, a couple more seconds here. A couple more seconds. Number 15 is C, potassium. Potassium. All right. Move on to number 16 here. I'll leave this one up here a little bit. But number 16 The inability to recognize familiar faces, even though vision is intact, is known as what? Give you guys a couple seconds to answer that one. A, B, A, gotcha. Number 16. A couple here, but this is a definition question. The inability to recognize familiar faces, even though vision is intact, is it's prosopagnosia. Prosopagnosia. Are we unsure of that one? Do we need an explanation on that one as to like what these ones are? I saw some question marks after some answers, so did everyone want an explanation on this one before I move on, just to make sure? All right. There's more people that want an explanation, but we'll do. If you're getting this kind of question wrong, I definitely recommend going through your material and making some flashcards for these, because this is pretty much just a definition. So if you got it wrong, don't really be too worried about it if you weren't sure what it is. But this is known as facial blindness. It's a neurological disorder where someone is they're unable to recognize familiar faces, and that's typically due to damage. It's the fusiform gyrus, which is located in the right temporal and occipital lobes, which is part of the brain that's really responsible for facial recognition. Aphasia is this affects speech. Neglect is a condition where you kind of ignore one side of your vision. Ignore one side of vision. This is damaged. I can't spell. This is a damaged right parietal lobe. And then dysarthria is motor speech disorder. So like this just causes like slurred speech. But definitely make some flashcards for some of your like pathology terms for sure. Are we good there? Just followed you on YouTube. Thank you. Appreciate it. Real good. I'm going to move on to number 17. So 17 asked, which part of the brain is most affected in Parkinson's disease? What part of the brain is most affected in Parkinson's speech? Give you guys a couple seconds to answer that one. Better be B. Yes, it is B. I actually did some research on Parkinson's disease in mice about a year ago. I shouldn't say a year. Yeah, almost about a year ago now. Alrighty. It looks like everyone got that one there. So we'll move on to number 18. Long-term potentiation, which strengthens synaptic connections, is most associated with which neurotransmitter? Pamela said that's cool. Thank you, Pamela. You guys a couple more seconds. So that is LTP, which strengthens synaptic connections, is most associated with which neurotransmitter? I'm going to give you guys a cut. Thanks for following. Appreciate you guys. I'll give you guys a couple more seconds, but I'm going to explain this one. Couple more seconds. But the answer is C, glutamate. So LTP is primarily mediated by glutamate. This is the brain's like main excitatory neurotransmitter. So whenever like a neuron is like repeatedly stimulated, glutamate binds to AMPA plus MNDA receptors on a postsynaptic neuron. So this allows calcium to enter the cell, which will trigger its reaction. So GABA is pretty much it's an inhibitory one, so inhibitory neurotransmitter. Dopamine is like, your reward, motivation, stuff like that. Acetylcholine is like, your attention and muscle activation. But hopefully that output inhibits. Alrighty. We'll take a look at the comments real quick. We good there? Looks like we should be good. Number 19, a lesion in the right primary motor cortex would cause weakness in which part of the body? I'm kind of leaning towards one side here. There we go. I'll give you guys a couple seconds to answer that one. All right, looking good, guys. The answer is B. So left arm and leg. Alrighty. Moving on to number 20, and then we'll go into the application questions. But the resting membrane potential of a neuron is typically around. You should know this one. Definitely an important one to know. You will definitely be asked this and will be expected to know it. So know this one. All right. A couple more seconds here. The answer is B, -70 MV. Everyone good on that one? Would the motor neuron be -90? No. Typical motor neuron is has a resting potential of -70. Could be, at least. Pretty sure it is. Explain 17. Did your AAP class use McGraw-Hill? Yes, it did. Sometimes it did. My main textbook was a professor-made textbook, though. What about for the previous question about the... Would be to the... I don't believe so. It would not be. Oh yeah, I don't like McGraw-Hill. That is not a very good resource. They are way too extra detailed for no reason. They have a lot of low yield information in there. So skeletal muscle has a resting potential of -90, but not neurons. The threshold is in neurons. We're talking about neurons. So the threshold is -55. The resting potential. Rest and threshold of a neuron. Does that answer people's questions? Are you going to post the next questions? Yeah, they're going to be on my Instagram afterwards. Does that answer the question? About the different thresholds in the resting membrane. So we're going over a neuron. So the neuron's different. Okay, thank you. Yeah, no problem. Have a good rest of your night. Okay, sweet. Alrighty, moving on. So these are some more application-based questions. So let's read through them. Number 20 asks, a patient presents with a sudden loss of pain and temperature sensation on the right side of their body, but maintains fine touch and proprioception. Which part of the nervous system is most likely damaged? Which part of the nervous system is most likely damaged? Give you guys a couple seconds to answer that one. But these are a little more advanced questions, so if you're having trouble with these, don't worry about it. These were grad school questions that I had. Can I fix the camera? Yeah. Sorry. Is this better? Sorry, sometimes I move it without realizing. Thank you guys for following. I appreciate it. Is this better? I can't really see my screen too well from where my camera angle's at. It's good. Okay, sweet. So number 21 is C. It's the left spinothalamic tract. Do we need an explanation on it? Yes, crosses at the level of spinal cord. Yes, that is correct. Alrighty, so the spinothalamic tract is responsible for transmitting pain and temperature. So pain plus temp from the body to the brain. So body to brain. So this means that the sensory information from one side of the body has to cross to the opposite side of the spinal cord. So why is that the answer? Essentially, sensory neurons, they enter the spinal cord and they immediately cross to the other side. So right-sided pain and temperature travels to the left spinothalamic tract. So any damage to the left spinothalamic tract would result in loss in pain and temperature on the right side of the body. Does that answer the question? Or does that help explain it a little better? So, so right side goes to left side. Immediately. Crosses. I'll put add spinal cord. All right. You are a great explainer. Thank you. I appreciate that. Hopefully, I'm helping out. I hate to interrupt, but I tried sending you an email, and it said undelivered. I've been getting some emails. Was it? Did you type the email in right here? I'll put it back at the top. At gmail.com. Oh, was that the issue there? It'll be on my Instagram afterwards as well. It's on my website too, so I forgot the E. Oh, gotcha. There you go. I have to take my first exam for the digestive system tomorrow. I have to name all the muscles on the cat. Oh boy. That is rough. I just posted the digestive system questions to YouTube. They're more so at the end of that live stream, but it's on YouTube now. Hopefully any of those questions may help. Alrighty, moving on to number 22 here. We have a patient has a stroke affecting the Broca's area. What symptom are they most likely to exhibit? Pretty confident I'll get 100, but we're on the cardiovascular. I don't understand it. Okay, we're actually going to do some cardiovascular at the end here. We only have 30. We have 30 questions for the nervous system, and then we're doing some cardiovascular. But I'll give you guys a couple more seconds to answer 22. Again, a patient has a stroke affecting the Broca's area. So which symptom are they most likely to exhibit in the clinic? Or just in general. But I need cardio. All right, so the answer here is C. It is the inability to produce coherent speech but intact comprehension. So the Broca's area is in the left frontal lobe, which this is speech production. So the Broca's area, let's put our definition here. This is speech production. Or like language output or anything like that. So a stroke affecting the Broca's area is typically called Broca's aphasia or non-fluent aphasia. And essentially it just impairs speech production, but leaves, like, obviously you're able to understand and comprehend speech. That part remains intact. So difficulty, let's go over A and why it's wrong. So difficulty understanding speech, but normal fluency. That would describe the Wernicke's area, or Wernicke's aphasia. So write that in here. B, loss of sensation to one side of the body. That would necessarily be more of, that would be an area in like the somatosensory cortex of the thalamus. So more so the thalamus. So that wouldn't be right. Involuntary muscle tremors and rigidity. That one, this describes Parkinson's disease. And it's a body movement disorder. Alrighty. Do I have nervous system study guides? Not yet. They should be up soon though. I was just making sure. My anatomy, well, not all my anatomy 1 notes are up yet, mainly because my professor skipped over some things. So I'm just going back and filling in those. Yes, I get those confused. Yeah, I always think of like like, this is kind of a cringe way that I remember Brocas area, but it has bro in it, so it's like, I always thought of like Brocas like bro, like, and you're like, obviously you have to speak to say that, so that's like how I always remembered that. Do I have a link to these notes? Yes, they are. If you go to my profile and then go to my link, my website is linked there. I have all my notes there. Oh, I'm currently using it, and all we use is McGraw. I feel you. That is why I had to make my study. That's why, honestly, that's what inspired McGraw-Hill's lack of just like efficient notes, or not even notes, but just an efficient textbook, are what actually inspired my notes, believe it or not. Oh, you have a good way to remember broke, MR? What is it? We can put it in here if you have a good way to remember it. Our study guides. Oh, boca means mouth. That is true. Oh, okay. I do know Spanish, yes. I'll put it in here. Thank you for that. I'll give you credit. I think 2 of you put that in there. If you guys want credit, I'll put your names in here if you really want. That's a really good way to remember it. That's way better than mine. Makes way more sense. Alrighty. Moving on to number 23. A patient with multiple sclerosis has demyelination of their motor neurons. Which of the following would be the most likely consequence? I won't remember both. Yeah, China says way better. Yeah, no, it definitely is. I will admit, mine was way worse. But I'll give you guys a couple seconds to answer that question there. Patient with multiple sclerosis. Ugh, can't talk tonight. Sclerosis has demyelination of their motor neurons. Which of the following would most likely be the consequence? What do you guys think about the Guiden and Hall authors? I'm actually not familiar with those, I believe. How often do I do these lives? I'm trying to do them every day. I'll be back again tomorrow, probably earlier in the morning. Do I have any questions about the lymphoid system and immunity and the cardiovascular? We're doing cardiovascular system at the end. We're doing cardiovascular system at the end of these, so I have a couple more questions, and then I have cardiovascular questions here, which I don't even think I... Man, I really messed... This format really got messed up when I was putting it through. That's weird. I did do endocrine earlier this week. I'm posting my endocrine video to my YouTube. It should be up later tonight. The video is processing right now. A lymphatic system, not yet, but I do have notes on that on my website. We're all on things heart right now, and blood right now. But anyway, so the answer here for number 23 is B. I have a decreased nerve conduction velocity. So demyelination, if you think what happens during demyelination is that's where nerve conduction is slowed down. Do we need an explanation? Can I do bones again, please? Let me see. Mary asked, can I do bones again, please? I missed it. I'm going to actually post the bone. So I already did it. I'm going to post it to my YouTube. So that one will be there, but I can do them again, yeah. And then, is your YouTube included in your website link? Yes. So if you go to my... Is my YouTube link included in my website? Yeah, so if you go to my profile and then go to like the links there, I have both my website and then my YouTube there. And then I uploaded the digestive system. So I have all of the lives from this week recorded. Mia has a question. So I'm in 10th grade, graduating early next year. Congratulations on graduating early. I want to become a doctor. Should I start studying? Well, you probably got like 3 or 4 years of college, so depending on like you might have to take anatomy and physiology in undergrad, so it doesn't hurt to start. Never hurts. But you'll be studying a lot there. It always helps to have some experience before going in. Moving on to, well, I guess, okay, some people want an explanation. So, were we good on that one? We explained. So, demyelination slows down nerve conduction. So when we talk about demyelination here, this means it slows, so decreases nerve conduction velocity. What speed? / velocity. Was there any other confusion on that one there? Okay, we'll check it out. Thank you so much for all your help. Yeah, no, thank you for checking it out. I appreciate it. No, good. All right. Number 24, a patient arrives at the ER experiencing head trauma. They display rapid breathing, increased heart rate, and dilated pupils. Which part of the autonomic nervous system is primarily responsible for these symptoms? Which part of the autonomic nervous system is responsible for these symptoms? Putting my neuro degree to work. Let's go. Congratulations on your neuro degree. Alrighty. But answer is C, sympathetic nervous system. Do we know why that is? Is that... Guyton Hall is a medical physiology textbook. I liked. Okay, yeah. I used Costanzo Physiology for my medical physiology. I actually thought... I don't know. I kind of thought it was okay. I thought it was okay. So... when you experience something like head trauma, you have sort of injury there. So the rapid breathing, the increased heart rate, dilated pupils is all part of your fight or flight response. I'm putting flight or flight. Fight or flight. So this is what happens. So the CNS, so sympathetic nervous system, is what's going to trigger that cascade. The physiological events to such like a stress or a trauma, which would be our head injury or head trauma, which would do the following there of like the rapid breathing, the increased heart rate, and dilated pupils. The parasympathetic is involved in like rest and digest things. So head trauma, no. Somatic nervous system is responsible for voluntary movements. These are not voluntary. These are all involuntary in a way. But then the enteric nervous system, that controls the function of the GI tract. So, put rest. This is voluntary movement. And then this is GI tract. Just going to take a look at the questions here. I dropped out 7 years ago and just got accepted into college. Oh, congratulations. That's awesome. I'm scared to learn A and P. You don't need to be scared. You just gotta put some work in. Can we do respiratory and lymphatic system? I did respiratory system earlier. I'm gonna upload that to YouTube either later tonight or tomorrow. It just depends on, it's processing right now on YouTube, so it just kind of depends on when it processes. But yeah, I'll do some. I have to take biology and chem first since yeah, dude. Biology and chemistry are not fun, man. I did not like taking those classes. I went through that pain. I feel you. Good luck though. Have you done the heart? We're actually about to. So I have a couple more nervous system questions, and then I have some cardio questions afterwards. Moving on here. Number 25 asks, a patient is given a medication that blocks voltage-gated calcium channels at the presynaptic terminal of neurons. What is the expected effect? What is the expected effect? Ooh, sorry, I bumped into that. I didn't mean to bump into that. Thanks for following, guys, and thanks for joining. I appreciate all your follows. If I don't get to everything as well, I also do have all of my study guides on my website. All of that is linked in my bio and everything. I'll give you guys a couple more seconds here. Number 25 looks like all you guys are getting it right here. It's decreased neurotransmitter release. I think we're good on that one. Are we good there? When taking a 5-year gap, would I have to start over? I guess it kind of depends on. It depends on what for. Is it for like? What would you be starting over to do? All right, looks like we all got that one right. I'm gonna move on that one. That one should be. Number 26. A person steps on a sharp object and their foot immediately withdraws while the opposite leg extends to maintain balance. Which reflex pathway is responsible for this action? Give you guys a couple. Some people were guessing. I'll give a couple more seconds and then I'll probably explain this one since we're getting a couple different answers. Anatomy class, even though you already took it. I don't think you need to take a whole class again. You could probably watch some videos and stuff, but that probably I doubt you probably remember more than you think you do. That's what because I took my undergraduate anatomy my freshman year of college, and then I took graduate level anatomy my first year of grad school, and I remembered a lot more than I was really scared because I was like, oh my gosh, this is gonna go so much faster, yada yada yada. But honestly, no, it clicks again really fast, so I wouldn't worry about it too much. Round number 26, Dalton. Anyway, so the answer is B, a cross extensor reflex. The cross extensor reflex is a protective one. It's a protective response. I'm going to abbreviate that RESP in both legs. Hold on. And that's to maintain balance. After stepping on the sharp object. So it's a somatic reflex, so somatic. It's involved the contralateral side, so opposite of the body. So in this case, when the person is going to step on the object, they're going to have a withdrawal reflex, causing that leg to move away from the painful stimulus. At the same time, the other leg is going to help maintain the balance and support the weight. So if you think about whenever you step on a sharp object and you're like, yeah, no, yow, and then you move your one foot away, the other foot stays there and balances. So that's that's the reflex that is responsible for that. But essentially why the stretch reflex is wrong. This is more so to help maintain posture. It's not really. This is more for posture. Posture maintenance. But it's not necessarily withdrawal. The Beninsky reflex. This is a normal infant reflex. So this is like whenever infants, their like toes fan out when you stroke their sole. So it's not from a pain thing. So it's in the feet. The motor reflex is it's an involuntary reflex in infants where if they ever feel a sensation of like falling or they hear a loud noise, they like spread out their arms. So infant normal arms. Did that help a little bit? What do I think the hardest? Thanks, Prashu, for helping us with anatomy. Yeah. The chapter I always thought the respiratory system was the hardest. I always had trouble with that one. Yes, past TBI. Yes, indeed. Alrighty, number 27. I guess you guys are already answering some more. Do we want to go faster? Do you guys want less explanations? But number 27 asks, patient with Parkinson's exhibits tremors and difficulty initiating movement. Which neurotransmitter is most directly involved in this condition? We're on number 27. 27. Is B, dopamine. Good job. Oop. B is correct. Alrighty. Number 28, a medical student accidentally cuts the ventral root of a spinal nerve during dissection. Which of the following deficits would occur in the corresponding region of that body? But if you're just joining us, we're doing some anatomy and physiology questions. I'm a medical student. Awesome. Hopefully this is good practice for you. You should know these questions pretty well then. I had my graduate school anatomy and physiology was with the medical students. So these are some questions that are there from ours. Number 28 is B. We'll go a little faster as well here just so we can get to the cardiovascular questions. 29, a patient is experiencing difficulty swallowing and hoarseness of voice after a stroke. Which cranial nerve is most likely affected? All right, give me a couple guys. Which cranial nerve is most likely affected? All right, couple more seconds. So give me 1 second. So I'm seeing a lot of people put, well, pretty much everybody has B. The answer is actually C. It's the vagus nerve. So give me 1 second. Let me make sure that's right. A lot of you guys put B, so I just want to make sure that I'm not actually wrong. Yeah. I mean, for glossopharyngeal nerve, it controls the muscle that elevates the pharynx when you swallow and like your gag reflex. There's mild swallow, but it doesn't really affect the voice. The key here is like the voice. Yes, difficulty swallowing is there, but it's really the voice. That's cranial nerve 10 is for voice production. That's part of it, at least. You check yourself. Yeah, no, I always oh, maybe I'm wrong. Yeah, it is C. It is the vagus nerve. Yeah, no, sometimes I definitely like to check myself. Sometimes I saw everyone getting B, and I was like, well, I thought that it was C, but sometimes I could be wrong. You never know. Sometimes I don't want to mislead anybody either. Yeah, so hypoglossary can control tongue movement. I'm gonna put this in red. Tongue movement. On the facial nerve, this is like facial muscles. And it does not affect anything. But this one, so pharynx elevation, some difficulty swallowing. But not but no voice. Does that help? Before I move on to the last nervous system question. Ooh, hold on 1 second. Of course, TikTok thinks I'm inactive, so I gotta do the little puzzle thing here. Oh, man. I always get them right. I know I do. These are like the stupid... If you've ever done a live before, oh my goodness, these things are so frustrating. Thanks for following. Alright, we'll do the last nervous system question here, and then we'll move into cardiovascular physiology. So a 65-year-old male is diagnosed with Alzheimer's disease, and they show significant memory impairment. Degeneration of which brain region is most associated with this? We have not gone over the neuromuscular junction and muscle yet. No, Addy. You guys, a couple seconds to answer. Alright, the answer is B. Oh, hippocampus. Looks like you guys all got that one. Alright, we all good on that one? Are we ready to move to some cardiovascular physiology? What do we think? Is that what I know some people were requesting both nervous system and cardiovascular stuff. Are we good with continuing on with that, or is there anything else we'd like to see? Thanks for following. Thanks for joining. Thanks for liking the live, guys. The more that you like the live, the more people we can get in here. Help out in anatomy and physiology. But do we want to keep doing questions for the cardiovascular system, or was there anything else that you guys wanted? I'll see what people are thinking. These questions will be on my Instagram afterwards. Alrighty. I saw some people were already answering number 1 here. What is the main function of the cardiovascular system? We did histology yesterday. I'm putting that up on my YouTube later tonight or tomorrow, as soon as it processes through YouTube. So that one will be there. So we did some histology yesterday. You're out here doing the constant work. Thank you, size cancer. No problem. Renal. Do I ever do strictly A&P biology tease questions? So normally this is just like your typical just biology, or not biology, anatomy and physiology class questions. We just did some nervous system questions, so. But number 2 here is D, the left ventricle. Thanks for following, guys. I don't really do tease questions. I have not done tease questions, but I can. Like I mentioned, I'm gonna put up my email. But if you want to send me an email of things that you want to see on live, I will put them in, and I will let you know when I'm gonna do them. So, dolly@gmail.com. Thanks for following. I appreciate you guys. So, send live request. It'd be awesome if I did some tease lives. Yeah, I've been having a lot of people reach out to me about that, so I think I'm gonna do one. Probably like sooner than later. So this should be pretty soon that I'll probably make one. I've been looking into it because I haven't taken the teas. So I've been trying to make sure it's thorough before I release it. Number 3, which of the following blood vessels carries oxygen-rich blood? Teas is, I believe that's like the entrance exam for nursing school. Am I right? Number 3 is B, the pulmonary vein. Circle too much. It is, yeah. That's what I thought. Someone asked a question here. Coronary sinus. So the coronary sinus returns deoxygenated blood back to the heart. Oh man, my thing got so big. So it goes, so you have coronary artery, and that supplies heart tissue. And then deoxygenated blood, so deox blood. Let me try to make some room here. I'll put it up here. Comes back through coronary veins, coronary sinus, and then back into the right atrium. Who's passed your test? Congratulations. I was so wrong on 3. That's all right. Can you write your Insta in the chat? Yeah, I can. Here's my Insta. It's medzeg.ollie. I guess that doesn't really help. Thanks for sharing, Jink. Thanks for liking. The more that you guys, I didn't see any. Yeah, for some reason, TikTok doesn't let me link it. I don't know why. I remember saying, try it before you buy it. Yeah, yep. Try it before you buy it. Exactly. Moving on to number 4 here. What is the name of the heart valve that prevents backflow between the left atrium and the left ventricle? Thanks for following, guys. Thanks for liking and everything. Like I mentioned, the more that you like the live, the more that this kind of gets out to people so that we can get as many people help for their exams. But it is C. Answer is C. I'll put it in here. Try before you buy. Try before you buy. Fixed screen a little bit? Yeah, sorry about that. Sometimes my screen moves on me whenever I'm using it and everything. Sorry about that. Sometimes I start writing and get a little carried away. Moving on here, what is the term? What is the term for the phase of the cardiac cycle when the heart is relaxed? Thanks for sharing. Can I do a quick overview of the whole pathway of blood flow? Yes, I absolutely can. We'll do that after this question. I can show you how I always remember doing it. So 5 is A. Do I do one-on-one sessions? Yeah, I have tutoring on my website. But you can also, if you want to see stuff in live, send me an email. I put my email up here. If you want me to do like a live thing on an exam review. But let's do. Are we all good? Do we want to all do a blood flow through the heart and like body and stuff real quick before we go on to other questions? Do we want to do that? I know one person requested it, but if we can get just to make sure so I don't go too off topic, if people wanted to see that. Yes, okay. Alrighty. So I normally start off by making 4 boxes. And I kind of draw my like crappy heart. So this is the apex. And then I use blue. And then we have here. Alrighty. And then alrighty. So this is how I start off. This is my lovely, I did not go to art school, guys. I did not go to art school. So keep that in mind. But this is here's our right atrium, our right ventricle, our left atria, and our left ventricle. All right, so starting out from our deoxygenated blood here. Our deoxygenated blood is going to come back. So this is from the body. And then we have, I'm going to put lungs up here. I know this is under the aorta, but it's obviously not under, but just here for purposes. Just says hello. So deoxygenated blood is going to return back to the heart here. So the inferior and the superior vena cavas. And that is going to bring blood back into the right atrium through the tricuspid valve next, into the right ventricle. It's going to go through the pulmonary valve, out through the pulmonary artery. It's polar. And then it's going to go to the lungs, where it is going to become oxygenated again. So pulmonary, remember, artery is away from the heart. So then once we become oxygenated again, we're going to return back to the heart via the pulmonary vein. It's going to go into the left atrium. Then we're going to move through the bicuspid valve into the left ventricle, where the heart is going to contract, and it's going to exit out the aortic valve through the aorta, out to the rest of the body. And then some is going to go through the, like we mentioned earlier, the coronary arteries. Thank you for the GGs, your wife. But we also have, I'm just going to copy and paste this because it's a little easier. But blood is also going to go to the coronary artery, to heart tissue. Then that's going to return to the coronary veins and coronary sinus into the right atrium again. Does that sort of help with the blood flow through the heart? When will I post this? Right afterwards to my Instagram. How are we all feeling about that heart flow explanation? Was that good? Thanks for liking and sharing the live, guys. I really appreciate it. Thanks for following. When it goes through the coronary sinus, is it deoxygenated? Yes. The coronary sinus is where blood kind of pools and it's in the posterior aspect of it. Thank you for the heart. I appreciate it. It's like a cotton ball heart puff. I think that's what it's called. I appreciate that. Thank you very much. So I got here coronary artery. This is where it becomes deoxygenated in the heart tissue. Gas exchange, the heart tissue becomes oxygenated. It receives oxygen. And then deoxygenated blood is going to come back to the coronary veins, coronary sinus, so deoxygenated again. So deoxygenated blood always enters into the right atrium. Lending this perfect right now. Have a perfect timing exam. Good luck on your exam. Good luck on your exam. All right, do you want to move back on to the questions now? I'm going to pass AMP to become paramedic because of you. I hope so. I hope that you pass. Good luck with that. Good luck with that. You definitely got this. Question, do arteries carry both oxygenated blood and deoxygenated blood? Yes. So I'm going to make a thing here. So the definition of an artery is away from the heart, and vein is toward the heart. So typically arteries carry oxygenated blood and veins carry deoxygenated blood, but there's cases where that is untrue. So pulmonary artery has deoxygenated blood, and pulmonary vein has oxygenated blood. O2, deoxy. Does that help that question, Mar? Does that help that question? Can we go over hormones? We did some already. We're going to keep doing some anatomy and physiology of the heart, internal anatomy. Were we good on these ones more? So typically it carries, yeah, except for pulmonary. Pulmonary is always the exception. So pulmonaries are exception. That's typically the only one. Pulmonary artery is to the lungs, yes. Give me 1 second. My thing is kind of glitching right now. Sorry, guys. 1 second. All right, back to the questions here. Someone asking some questions. Brian OD, are these questions like stuff you want me to go? I mean, these are a little longer of explanations. Do we want to go over those? We cannot see the questions. Okay. to the left. We can go over them at the end there. Those require a little bit longer of explanations, but we can go over them kind of near the... We can go over those questions at the end. Hold on. Is this better? Yeah, we can review the layers. Let's go over the questions and then we'll do some cardio review. Alrighty. Which part of the heart's conduction system is known as the pacemaker? We're going to start going a little faster here. Great. B. Yes, it is B, the SA node. All right, moving on. Number 7. Which blood vessel has the highest blood pressure? We got a couple seconds. C, yes, arteries. Good, good, good. As I mentioned, these start off a little easier and then we'll get a little harder as we go along. 8, what effect does the sympathetic nervous system have on the heart? We kind of talked about this because we did some lung physiology earlier. And then there was a question kind of similar to that. B, increases heart rate and contractility. Yes, increase heart rate. Number 9, which layer of the heart is responsible for contraction? So I said we will go over the layers of the heart here, so don't have to worry about that. B, yes. The myocardium is responsible for contraction of the heart. So 7 is C, because well, there's a lot of different math that goes into why, but essentially for arteries the pressure is the highest because the ventricles, when ventricles contract, pressure has been building up inside the heart, and that pressure is what releases it out to the rest of the body. And then in veins, there's less pressure because if there's more pressure, it would be harder for blood to return back to the heart, which you don't want. Yes, it was a mean arterial pressure thing. Yes. But number 10, which of the following conditions is caused? I should make sure, is my screen still good, guys? I think maybe to the left a little bit. Sorry. Volume equals pressure, yes. Which of the following conditions is caused by blocked coronary arteries leading to reduced blood supply to the heart? Should be a pretty easy one. The answer is C, myocardial infarction. Welcome, welcome. Welcome to the live stream, guys. We are doing some cardiovascular questions now. Thanks for liking and thanks for following, everybody. I really appreciate you all. Alrighty. Were you good on that one? Are we ready to move on? If I miss any questions, too, let me know. Sometimes I can't always see all the questions through the answers. What ion is primarily responsible for the plateau phase in cardiac muscle action potentials? This is a fun one. This is definitely a fun one. Oh my god, I needed this live yesterday. I'm so sorry about that. I'm so sorry. I wish it was not so. Sometimes I'm right on time, sometimes I'm too late. But the answer here, so this is calcium. So if we think about this is where, so calcium is responsible for this phase, the plateau phase. Do we need to go over cardiac muscle action potentials? We did not learn this. You should learn about cardiac potentials. Do we want to go over that? All right, yeah, we can go over it. Well, let me make a blank sheet here. I figured this is kind of an important thing to learn, in my opinion. So, excuse my drawing here. Let me just make sure I'm all in frame. So, we have our... there's like a little dip, so... Alright, so I'm going to use NA here. So we have... during depolarization, this is when sodium channels are open and potassium channels close. And this is where calcium channels start to open, but they're not all the way open yet. So during this phase is where sodium ions are coming in. I'm going to use green for potassium. But during this phase here, the early repolarization phase and the plateau is where calcium is exiting. I'm sorry, not calcium. Potassium is. We have calcium. And this is where calcium enters the plateau phase. This is what causes the plateau. So this is early repolarization, the plateau. And then the final repolarization is when the calcium channels close and the potassium channels are fully open. I'm still beyond an AMP. So to recap, just real quick. Depolarization. NA. I want to abbreviate channel as CHN. Channels open. Potassium. Channels closed. Calcium plus channels start. Then we have early repolarization. So Na closes, calcium's open, or potassium. I keep saying that. I'm so sorry. I don't know. I've always done that. That is just a habit. I don't know why I cannot break. And then final repolarization. Is CA plus close plus open fully. Alrighty. Action potential. Alrighty, was that good, guys? Is that did that kind of help recap that? Best for learning the whole skeletal system, just practicing labeling. The way I was literally just watching this on YouTube. Yes, the Ryan, that is right. I was in here yesterday and I aced my exam. Let's go, Whitney. Congratulations. I have a quiz on cardiovascular system. Good luck. Not the contractile. It's cardiac cells. Are we all good to move on back to the questions? Sorry, I just looked at the comments here, so hopefully I'm not too far behind, but I'm in the cardio unit right now. This is helping so much. Awesome. I'm glad this is helping. All right, back to questions. You guys can screenshot this, but I'll also post this to Instagram afterwards as well. Alrighty. Do I do exercise physiology too? I can, yeah. I took exercise physiology. I was a double major in exercise science and biomedical sciences. So we did respiratory physiology a little earlier, but this will be on YouTube a little later tonight or tomorrow. Ron zooming out a bit, yeah, absolutely. I'm gonna have an exam next Wednesday. Good luck. But anyway, 16. Which blood vessel types has the greatest total cross-sectional area, slowing blood flow to exchange nutrients and gases? I feel like I've been live for so long. How long has it been? An hour and a half. I zoom out slightly. This is about as far as I can zoom out. But anyway, number 16 is B, capillaries. You guys are awesome. Moving on to number 17, which type of shock results from a severe allergic reaction causing widespread vasodilation? Yes, C. Awesome. Anaphylactic shock. Ooh, terrible circle. All right, number 18. Which hormone increases blood pressure by promoting water retention in the kidneys? Number 18. If you're just joining the live, thanks for joining, guys. We're going over some cardiovascular system questions. Be aldosterone. Awesome, guys. Awesome. Number 19, a patient has a heart murmur due to valvular regurgitation. What does this mean? Also, if you're just joining this live, again, thank you for joining. I do post this to YouTube afterwards. The link to my YouTube is in my bio. So you can go rewatch anything that you missed. But number 19 is B. That is correct, guys. Awesome. Thanks for all the follows. I really appreciate you guys. The valve does not close properly, allowing the backflow of blood. Number 20, and then we'll go into some, this is just anatomy and physiology. I double majored in biomedical sciences and exercise science. And then we're going to go into some application questions. Number 20, during strenuous exercise, how does cardiac output increase? A couple different answers here. But yes, the answer is B, by increasing heart rate and stroke volume. Awesome, guys. Who is? People are always inviting me to co-host. If I don't know you, I will not co-host. What am I planning on doing after I graduate? So I actually already graduate. So I did my... Hold on one sec. Here we go. Anyway, so I guess I can write this out, but I did my undergrad in biomed plus exercise science. And then my graduate degree is in molecular medicine. And I just graduated in November, and I'm currently applying to PhD programs. All right, move on to the application questions here. I'm just going to look at the comments real quick, and then we'll move back. Is this stuff for medicine and nursing? Yes. LOL. I was like, how come my exams are not this? Yeah. It's my dream PhD program. You want to be a professor? Yes, I love this for you. Thank you. Yeah, we're starting. I make them a little easier, and then we try to get into some application-based questions just to warm everyone's brain up about it. Number 21, a patient presents to the emergency department with shortness of breath, fatigue, and bilateral leg swelling. An echocardiogram reveals reduced ejection fraction. Which of the following is most likely the diagnosis? Everyone move screen over. Yes, alrighty. The answer is... Awesome. C, congestive heart failure. Looks like all of you got that one right, so... Alright, number 22. A 65-year-old male with a history of hypertension and diabetes mellitus arrives at the clinic complaining of chest pain that worsens with exertion and improves with rest. Which of the following is most likely the cause? Which of the following is most likely the cause? Awesome. B, staple angina. Alright, moving on here. For some reason, these didn't get the 2 in front. My, system here got really messed up for some reason. Anyway. Did I ever answer... Tinley Vance, did I ever answer your question? I had to answer a call. What was your question? I probably missed it. Where do I get this test? I made this myself. But number 23, or I guess we can go by 3, but number 23 or 3. What is this? This is the cardiovascular system. Questions. 30-year-old female presents with sudden onset palpitations and dizziness, an ECG. My plans are to apply to I'm applying to a PhD school right now. I just finished my master's in November in molecular medicine. Do I post these to the public where I can view? Yep, it's going to be on my Instagram right after my live. My Instagram is medzig.ollie. What about you? What are you, or do you have any, what's your major, Tinley? Which mechanism is most likely responsible for her arrhythmia? You're in pharmacy school right now, so I saw these questions. Gotcha. I was a pharmacy tech while I was in school. I know a lot of pharmacists. Pharmacy school is definitely not for the weak. I do want to be a professor, yes. I would love to be a professor. A lot of the reason I do this is practice for it, so I can, hopefully be a great professor one day. But number 23 is C. Is this for PA school? It can be. Number 23 is C. Do we need an explanation on that one? What was the topic of this live? Sorry, I just got here. If you just got here, we are doing cardiovascular system questions. I will be posting these to YouTube from now on afterwards. So if you're just joining and you missed some, we did the nervous system earlier, and then we're doing cardiovascular system now. So if you missed the earlier questions, they'll be on YouTube afterwards, and the link to that can be found in my bio. All right, so why is C correct, first of all? Let me make sure here. So atrial fibrillation. This is an irregular rhythm with no distinct P wave. So I think someone put it in the comments, but it is right. The cardiac massage. Ooh, can't write that. Slows ventricular rate, but not. It doesn't terminate. It does not terminate AFib. Just put end AFib here, just to save room. Answer choice B is incorrect because it has a wide. The VT has a wide cardiac sinus massage. And it does not respond to that. And then the sinus bradycardia is just a slow rhythm. I always remember slow rhythm as bradycardia is like Tom Brady is really slow in the NFL. If you watch football, that's how I always remember that one. But this is the most common cause. Because it has a narrow QRS. Means that it is above the arrhythmia originates above the ventricles. So above ventricles. So it activates the vagus nerve. So increases. Let me make sure. Do I got everything in here? Zoom out a little bit. AV node refractory. Period. Plus the breaking the circuit plus circuit. Does that help answer that question? Because Tom Brady. So I'm glad somebody liked that. Do I have a PDF with the answers? Yeah, it's gonna be on Instagram. What am I writing on? I'm writing on the. Oh, let me zoom out. Sorry about that. It's a second generation 12.9 inch iPad. Are we all good there? Green, yes. All right, we're gonna move on. To number 4. Patient with chronic kidney disease has persistent hypertension despite being on multiple antihypertensive medications. Laboratory tests reveal hypokalemia. Which antihypertensive medication is most likely responsible? Give you guys a couple seconds. C. The answer is hydrochlorothiazide, and that is yes, peanut hot dog 10. You are correct. Diuretics flush out potassium. Do we want an explanation on that one at all? For number 4 or 24? I just messed up my labeling on the numbers, but it's 4 or 24. Thanks for following. Yeah, hyper. All right. Source of chronic cough, yes. First one as well. Sorry, hold on. My computer is glitching here. I'm trying to read your comments, but it's not showing up. Hold on. Sorry, guys. Bear with me. I think my internet might be just slow. Probably because I'm streaming and trying to upload YouTube videos at the same time. Alright, well. I may not be able to see your comments right now. Okay. Yes, okay, you guys do want an explanation. Okay, anyway. Mainly because of ACE. So, lisinopril is wrong because ACE inhibitors cause hyperkalemia. Not hypo. Have to look at the portion of nephron and axon. Yes, that is true. That's how you would know. My internet is getting spotty, guys. I'm not sure how much longer I might be able to stay on the line. Is the quality good? Because my things aren't looking. Alright. I think we're good now. So this causes hyperkalemia. And lodipine is a calcium channel blocker. They don't really affect... So it's a vasodilator, but it doesn't really affect potassium levels significantly, so it would not cause hypokalemia. And metoprolol is a beta blocker. They do not typically cause hypokalemia. They can slightly increase potassium, but not enough for it to cause hypokalemia. Maybe a little light, okay. I'll speed up the questions here, just because I've been live for kind of a while now, so I think that's probably why. But number 5 or 25, a trauma patient presents hypotension. Trauma patient presents with hypotension, distended neck veins, and a muffled heart sound after a motor vehicle accident. What is the most appropriate initial intervention? Give you guys a couple seconds. What is the most appropriate intervention? Someone mentioned the triad. So the answer here is B, pericardiocentesis. We probably need an explanation on that. So IV fluids, yeah, they would be partially helpful, but if they're only used alone, they can worsen heart strain. Beta blocker administration, that would lower heart rate plus contractility. which could lead to hypotension, which could make it worse. Diuretics. This would worsen hypotension. Mainly because of it reduces intravascular volume. This is right. So this removes fluid from the pericardial space. So that would relieve the pressure. All right. Does that help? Is that good? But I'll move on here to number 6. Last 5 questions here, guys. It says a 50-year-old man presents with severe tearing, chest pain radiating to the back. His blood pressure is 180/110. A chest X-ray reveals a widened meniscum. What is the next best step in his management? What's the next? So I'm seeing on A, but the answer is C. Order a CT angiogram of the chest. So Maru got that one right. See, Ozzy. Why were we thinking A? Why were we thinking A? Just to make sure. Sorry, if I'm loading your comments slow, it's just because my internet is running really slow right now for some reason. So I saw there was a lot of A's here, but so the thing here with A, I'll go over A. So administering a sublingual nitroglycerin tablet would reduce preload, and it could cause tachycardia in the situation, which would increase his aortic wall stress. I saw a lot for that. Yes, that's why you would want an angiogram. Essentially, this would just allow you to see the aorta, obviously. And the extent of the ditch section. Alrighty. Row number 7 here. Yeah. Patient recovering from a myocardial infarction is started on metoprolol. What is the primary benefit of this medication in post-myocardial infarction patients? B, that is correct. All right, moving on to number 28 or 8. Nurse is monitoring a patient who received a large dose of nitroglycerin for acute chest pain. Which of the following vital signs Change should be anticipated. Give us a couple seconds to answer that one. A nurse is monitoring a patient who received a large dose of nitroglycerin for acute chest pain. Which of the following vital signs should be anticipated? The answer is B. Decreased blood pressure and an increased heart rate. Do we need an explanation on that one? Are we good? I saw some majority of the people got it right. But it is B. It decreases. It's you would expect decreased blood pressure and increased heart rate. No. Alrighty. Alright, we're gonna move on here. A lot of you have already been answering number 9 here, but I'll read it out loud and then we'll go through. Patient with atrial fibrillation is prescribed warfarin. Which of the following should be monitored regularly to ensure the safety and effectiveness of this medication? But you guys are correct. It is B. A lot of you guys have already been answering that one. That is correct. All right, and we're on our last question, number 10, or number 30. This is supposed to be number 30, but I messed up the numbering, so sorry about that. 45-year-old male presents with exertional dyspnea syncope. A harsh systolic murmur is heard over the right second intercostal space and increases with scotting. Which of the following is most likely the diagnosis? Give you guys a couple seconds. It's most likely the diagnosis. Thanks for following, guys. Appreciate it. I'm going to add a little thing at the end here. Awesome. It is C. It's aortic stenosis. So that was all the questions that I did have for the live. So thank you guys for joining and participating. I will be live again tomorrow at 10 a.m. Eastern Standard Time. Everything, so you will get all the pictures. So the questions will be on Instagram, and the video, if you missed anything, will be on YouTube. Ollie. And then send me some requests for lives via my email. I'm just going to write these in real quick. I should actually just put this at the end in a text. How'd you decide to YouTube topics for tomorrow? Yeah, there's the last question. So again, all of this will be on IG, on YouTube, link in bio. So again, I will post all these questions, like all the notes and stuff, to my Instagram. The recording of this will be on YouTube afterwards. It'll be up tonight or tomorrow. Everything's kind of processing. I'm still kind of figuring that out. It's just such a large file, so it takes so long to upload. Thank you very much. This is very fun and informative. Can I explain the last question? Yeah, we can explain the last question here in just a second. So I do have to get going because I've been streaming here for a little over 2 hours now. So, but again, if you want to send me any question request, or not a live topic requests, send them to my email. Time for tea? Yeah, me too. That's exactly what I'm going to be doing. Thank you. Good night. Good night, Pamela. Thank you, Hannah. Thank you as well. Chatter, good luck for tea. Bree, you're welcome. Thank you as well. But again, I love you. I love you guys as well. Yeah, no, you guys are my heroes too. You guys make this possible. So, then my study guides are on my website if you guys want those. Website link in bio. Thank you. Night. Yeah, good night, guys. Thanks for joining. I really appreciate you guys. Thanks for liking and everything. Thanks for all the donations and stuff. As someone asked to explain number 10 real quick, the last one. So regurgitation is wrong because so this would present a hollow systolic murmur at the apex, so not the right second intercostal space. B is wrong. It's essentially the murmur decreases with squatting. So this is also heard best at the left lower sternal border. And then the last one, D, is incorrect. Normally due to increased pulmonary. This is normally as a result of increased pulmonary blood flow. But again, this will be on my Instagram afterwards. Do I go over microbiome? I can go over microbiome, yeah. Like I said, I have live request topics here. Just request it, whatever, specifically what you want to see. I have biochem and microbiome exam tomorrow. Yeah, good luck. I will definitely be praying for you. Were there any other quick questions here before I go? Yeah, Hills, just send it to, if you have any certain things you want to see, just send it to this email. I'd gladly take a look at it. But my study guides are on my website. Link to that is in my bio. The video will be available at the end as well on YouTube. YouTube channel name, can't find it. I know it's my name. I would go to my, like I said, go to my link in my bio for that. It'll be easier to find. I'm a new grad. These videos help a lot. Awesome. I'm glad they're helping. Thanks for following, guys. Really appreciate it. But it should be just my name. If you're having trouble finding my, but can't join. Addie, I'll make a video for it. Addie, can you send me an email? Again, I'll make a video on it and I'll post it tomorrow. I'm taking this class right now. I need help. I need more help and understanding in this class. I can definitely make a video on that. On helping you remember stuff more and understanding. Addie, were you good on that? Did you want to send me? I'll make a video for you. So we don't have to do it during the live. And you can just watch the video for whenever. Okay, thank you. Yeah, no problem. Alright, thank you. I came in here. Yeah, this will be on YouTube. I can make a video on that stuff. But yeah, you just send me an email about it and I'll just specifically what you'd like to see and everything. So any more questions here before I go? It's just my name. It should be linked in my TikTok bio. But if you can't find it, send me an email and I'll send you the link. Not tonight, no. I've been live for long enough. It's time to call it a night. I'll be live again tomorrow. If you want me to go over something, please send an email again. I'll be more than happy to go over it in a live tomorrow. All right, any more quick questions before I go? Again, I'll be live again tomorrow at 10 a.m. Alrighty, guys, have a good night. I'll see you guys tomorrow. Again, here's all the information here. This will be on Instagram afterwards and YouTube. Send me any emails if you have any questions. Thanks for watching, guys. I really appreciate it.